We work with a whole lot of academics working on national programmes. So we've done a large NIHR programme which was looking at using a digital intervention with 10 to 12-year-olds about brushing their teeth. And that was really interesting. We got to travel all over the UK for that one. We've been working on some MRC grants. We do a lot of work with NHS Digital, Health Education England. We're doing a lot of work for NHS England at the moment with the iApps technology. And we also worked with a whole lot of SMEs to get their apps on the new NHS Choices App Store. And what I'm going to talk to you about today is some work we've been doing in Leeds for the last 3 years, which was fully commissioned. I'm going to scoot through. One of the things that we had real issues with a lot of the digital work we do is that people think they want an app. And usually that's the last thing they need. And we had some fantastic mental health commissioners in Leeds who commissioned us to do a process. The end process was just to have some kind of ongoing digital tool that supported improved use of information and made things a bit simpler for service users. It was part of the Mental Health Framework Programme Review. And it was a cross-cutting thread across, so some of you may be aware of that work, which focused more on community and urgent emergency care. But ours was right across, so we very much started with a very open vision, which was to provide a simple route for people, everybody, citizens, patients, carers and clinicians, to be able to find their way through the mire of mental health information. We had 10 user groups that were defined based on a whole lot of work which took about 3 months. So we did literature reviews, we looked at data for the city, we looked at demographics, we looked at workforce information and came up with 10 personas, which are a bit like vignettes. But you don't use them publicly particularly. They're a tool that we use during the digital design process. So, of course, we had one for GPs and one for mental health practitioners. We had one for third sector workers. We had them for care. You know, there was quite a large group of them. And what we do is we go backwards and forwards to them as we're working on MindWell's content. So this is basically a diagram that shows you the sort of co-design process. But what we decided to do from the off was to do all the co-design work with practitioners, patients, carers, citizens in the room at the same time. So we started those conversations from the word go, and people really collaborated, people were really honest about the challenges that they were facing, the frustrations, lots of frustrations about what people hate about websites, pop-ups being one of them. And what I wanted to show you this picture, so the picture in the middle was actually a community mental health team's response to digital. So they had a little area in reception that had a computer and a big board around it with these things on which were paper copies of information. I just love it. It's just so fantastic. So it's a mixture of analog and digital all in the same place. But that was a very early way of trying to make this a bit easier for people. The other photos are very much around the digital design tools that we use. So the one at the bottom is called card sorting, and I can highly recommend it. We use it and use it and use it. And it really helps you focus on what digital content you want. And it makes you be very disciplined about that and try and think about logical journeys through the content you might want to share. The big issue really was around people feeling they didn't have a voice, and that was true of the practitioners as much as it was of citizens and the service users. And we had the fantastic Leeds Involving people who were are really just absolutely brilliant. They gave us all sorts of opportunities to really drill down with people about the kind of content that was useful, things that weren't useful, and early insights into accessibility needs. So the accessibility stuff is something we have a bit of a sort of slightly obsessional passion about. When you start getting into digital, you realise how hard it is for people to access information on an equitable basis. So, for example, we have one user who's we have an online group who we constantly send stuff to. And her eyesight was deteriorating through the project, and she was fantastic. She came to loads of user testing sessions for us and gave us feedback about some of the challenges she'd got with the fact that she could set up the settings on her laptop for one site. Every time there was an update of Windows, it all went again. She had to set it all up. And in the end, she couldn't do that for herself, so she had to rely on someone else. That's not independent use of digital, is it? So she's been fantastic, and we have a whole group of people who do that for us. So these are just some of the elements that we're trying to address. We have a version of Browse Aloud. I don't know if you're familiar with Browse Aloud. When I show you the site, it's a little orange button, and it will translate the site into 200 languages, and it will read it out loud in just under 100. You can also strip it back, so for people who can't cope with all the colours and what have you, you can put it on a different setting which just calms it all down. That said, for those of you that have been on MindWell, the I Need Help Now section, which was very much built with our urgent emergency care friends, is much simpler, much more stripped back and quieter colours. As you get through the site into the sort of recovery areas, you will notice, probably subtly, it gets a bit busier, and the colours are actually a different colour palette, so they're stronger colours. And the idea was that we had a quieter area and a more energising area. So we've done this, as I say, obsessional detail. So I think the reason that MindWell is a different website is that we have built it from nothing. We were given a really open remit from the commissioners, which has made all the difference, really. And everything we do, every bit of content, goes through a user group. We have a network of clinicians and experts who check and help us write all the content, and it doesn't go live until that's been okayed. We have a mirror site of MindWell, which is not on the internet, and we test out stuff on there before we make it go live. So it's belt and braces, really, to try and protect MindWell. We're very aware that it's now on the 111 service directory. We do a lot of work with NHS Digital's Choices team, and so we're trying to mesh that all into the processes nationally. We have big discussions about syndication and all that kind of thing. But we did do quite a lot of work in primary care, and we had some fantastic practices. Those of you know Chris Mills's practice. We did his entire practice on a whole day. We did all the staff, everybody, and they were fantastic. Gave us really good feedback. So we've really drilled into the detail of what's going to work and what's not, but we've got a lot to do. So this is just feedback from one of our users from one of the autism service users. So what I wanted to do is just really fly you through the process we're using at the moment to improve the professionals section. And we've debated about whether we should call it practitioners, professionals, staff. It's really for everybody, and the whole site is open to everyone. So everything that goes on there, we always stop and think about the language with citizens and service users, just trying to respect the fact that some of the language we use is not necessarily easy to read. So with the employers area, we've done a lot of work with the employers in Leeds, big employers like Skybet, as well as the NHS Trusts, the council. And what we're trying to do is sort out an area that employers can use to support their staff's well-being. So the process we've used the card sorting exercise that I showed you earlier. And out of that, I don't know if anyone's heard of Trello. Oh, Google it, it's really good. So Trello is like a project management tool, but we create Trello boards for the content, And it's really useful because you can move the boards around. So if we change the title of a section of content, we can move it from one place to another. So this is what we've created with a bunch of employers who have been great and just really said, well, that's no use to us. When I've got a member of staff who I'm worried about, what do we do? We have information on MindWell, which is been created by community mental health team members, primary care liaison workers, have given us scripts that we've made into animations, and one of them is for employers about how to start that conversation, and that was actually done by the head of HR at the Faculty of Medicine and Health at the university, who they've been doing a lot of work around trying to improve the staff's understanding of mental health needs, and so they've been working with us. So what we really want to do, Zoe Neal, who some of you may know, has been our lead for MindWell. Sadly, she's not doing this anymore, but we really need to improve the primary care, the GP section in particular. And we want to do a similar process to what we've been doing with the employers. We've got some resources, we've got various things, we've been trialling it for as it is. There's a lot of work to do on it, and we really need, it's a bit of a call to action really, we really need some help. So this area we created with the GPs and the GP practices that have been involved to date. We do need to do a lot more work to it. So we've got things like guidance and referral links. There are a lot of click-throughs. It's a bit too long, really. We've also added on the I Need Help Now section a link to self-referral information. We had a bit of an incident with somebody feeling they couldn't find the information, so we've just put it on the front page. But I think there are lots of areas here that we need to know from people really what would work better for them. We've got some screening and assessment tools. These were all asked for by the GPs and practice staff. So we've got things like the GAD-7 and the 6-SIT. But there's a lot of work to be done, and we really would like you guys to give us a hand or get involved. We can do it online. It doesn't have to be attending things. This is the self-referral information. There are a lot of audio-visual tools on here which we'd like primary care to use a bit more. We can see who's using what, obviously, from our Google Analytics. But I think the other thing to say is that we're doing a lot of work with Leeds Teaching Hospital Trust and the urgent and emergency care teams around how to have a digital conversation with somebody and signpost them appropriately to MindWell. We have had some mix-ups where people feel that their GPs have told them that they need to go to MindWell as though it's a service. There's a bit of confusion about the fact that MindWell is an information website and a signposting service. We did decommission Mind's mental health directory, so there was less confusion, so that's gone now. But we still need to do more. We still need to do more to get citizens who are at risk, and we had one last week who contacted us in desperation, even though they knew there was no service, and we were able to link them up with a service. That was a young person who was feeling suicidal. In desperation, they came through to MindWell, and I just think there's probably a lot of other people out there that we need to do better for, and they've gone straight to the right service now, so we managed to avoid any urgent care. But I think, we know we've got a lot to do. We know we need to serve our communities better, so we are continuing to develop the areas and resources and audiovisual resources. So it's a bit of a call to action, really, to just let us know. Ooh, let's see if I can get back to my presentation now. So that's all I'm going to say for now. These are all our awards, which we're very proud of, especially the Plain English Award, which was we're really delighted to get. That's me.